Welcome back. You all know the drill. I'm Alex, and today we're going to be continuing the discussion around mental health and comedy. Today, I hope to provide an explanation for why, scientifically, comedy has the impact that it does, in the hopes of uncovering how it can be most advantageously applied in a clinical setting to combat a growing mental health crisis in our world. First, I want to talk about some of the science behind laughter, specifically how it can affect our brain. According to Richard Wiseman, head researcher of the Laugh Lab experiment, who scanned participants' brains as they reacted to jokes, the main parts of the brain that are activated during this process are the frontal lobe and the temporal lobe. Now, I'm not a neuroscience person, and I'm sure someone can explain this better than I can, but the fact that these areas are the most active makes sense. The frontal lobe tends to deal with reasoning, as well as understanding social norms, among other things, both of which allow us to make sense of the jokes, as well as to feel shock and surprise from the unexpectedness of the punchline. The temporal lobe regulates language understanding, as well as emotions, which allows us to understand jokes but also regulates our emotional response to them. Wiseman's research found that people with stronger frontal lobe activation prefer different types of jokes, more complex ones, to those with lower frontal lobe activations. My hope is that this understanding will allow people seeking to use humor as a therapeutic tool to find the method of joking that works best for them and their mind. Beyond just neural activation, laughter also provides neurochemical relief. Researcher Jong-Yun Yim, in his review of therapeutic benefits of laughter, outlines how, in 3 groups, one with severe depression, one with mild depression, and one without, serotonin levels, or a hormone that acts as a de-stressor and helps one's mood, increased after laughter therapy. Laughter can also increase dopamine and, in some studies, is shown to promote lung, heart, and digestive health. Understanding this, I believe, is the first step towards appreciating humor as a possible way to combat a growing mental health crisis, which I'll talk about next. Before we get into it, I want to go back and remind all of you why I've chosen to focus on humor specifically as a way to combat mental health issues. And that's because humor has the unique ability of empowering people who are facing challenges and encouraging them to develop a mindset of growth and positivity no matter what.
It's just a wonderful way of building their confidence, because what I say is, once you've done stand-up, you can do anything. You can get a job, you can go back to school, whatever it takes.
Being able to stand up and to share not only your own ideas with the world, but your happiness and your laughter through comedy can empower you to assert yourself in other ways, and this leads us back into our discussion on mental health. The past years have brought to rise a shift, one towards a more holistic style of healthcare than in centuries prior. And by that, I mean that one term has really gained prevalence: mental health. Until the 1940s, there was no term for something like this, when William Sweetser coined the term mental hygiene. From then on, psychologists and supporters of mental health care fought to get mental health into mainstream medicine. In the early 1900s, after World War I, psychiatrists turned their attention to patients with what they called shell shock, now PTSD. And especially American doctors, who had a more open mind when discussing mental health, were able to get better results in treating their patients and focusing on their holistic treatments of their mental illnesses. But there was a distinct lack of respect in the discussions surrounding mental health. And those who had schizophrenia, PTSD, epilepsy, and depression were often sent to mental institutions where they received dehumanizing, inadequate and generalized treatment. In the 1960s, during the counterculture movement, there was not only a call to reform the system of institutions, but also to treat mentally ill people with respect. For example, we see books being published like One Flew Over the Cuckoo's Nest or The Bell Jar, which humanize individuals with mental illnesses. And that was really it until 2020 in the COVID-19 pandemic. According to the World Journal of Psychology, over 30% of people worldwide face some mental health problem, representing a 30% increase since the beginning of the pandemic. In general, these problems tend to be depression or generalized anxiety, and they tend to affect certain groups more than others, like low-income individuals, women, essential workers, and youth. And the main reason for this is the increase in social isolation, as well as pressure felt by certain groups. Essential workers, for example, felt an increase in pressure due to shortages in sectors like healthcare, and youth lost the ability to connect with peers and to develop essential social bonds. Even after the shutdown ended, mental effects still lingered, and stigmas, as well as a desire for a return to normalcy, led to many not confronting their stress. In general, mental health problems are treated through CBT, like I talked about in my previous video, where a patient goes to a therapist who leads them through a program to retrain their negative thought patterns. But this really only works when people are willing and able to find a therapist and to dedicate large amounts of their time and effort to the programs. The most common form of mental illness is known as generalized anxiety disorder, which can be hard to detect. Those who are affected by it don't often seek treatment or even know that something is wrong, putting our previous 30% estimate of people with mental illnesses as a clear underestimate. And many people who are aware of their own mental struggles don't always believe that they need therapy. It may seem daunting, expensive, or like an admission of defeat. And so I would like to present an alternative. Comedy. Of course, comedy can be a form of CBT like I discussed previously, but it can and has been implemented successfully in workshops and group therapy. The 7 Humor Habits, a book by psychologist and humor researcher Paul McGee, is at the forefront of humor therapy. It outlines a 7-step program to incorporate humor into your life and to be happier and more fulfilled. I'll put the 7 steps on screen right now because I think it's important to know what they are in order to figure out how best to use them. It's important to note that this certainly requires a lot of dedicated, thoughtful effort. Just because it's comedy focused doesn't mean it's easy. I mean, 8 weeks, which is how long the program typically lasts, is a lot. And the humor log that it recommends is reminiscent of a traditional journal, which requires a lot of self-reflection and consideration. But comedy is also a more accessible form of therapy. People enjoy laughter, and some find it easier to talk about their struggles through a comedic lens. And, according to Mr. Lowe, humor can also be used to bridge gaps between generations and to spark conversations around mental health with students.
Yeah, especially I think the humor can also go, be presented to across ages, right? Mm-hmm. I think there might be like materials for mental health related that's definitely really heavy, and some of the language can be really difficult for maybe a younger person to understand. But if you present it in a more humorous way, that can be presented to different ages, and different people can get into it.
Yeah. And all of that goes to show not how comedy can replace therapy or anything, but how it can serve as something more accessible to a wider range of people. And now before I go, I wanted to take a step back and overview what I find to be the 4 most important theories of comedy as a whole, basically trying to answer why do we laugh, and what those theories can tell us about the medium of comedy, as well as how we can tie that to our conversation about mental health. The first is superiority theory. Basically, the idea is that your laughter comes from your feeling that you are superior to the target of the joke. The works of Aristotle, Plato, and Hobbes all contain elements of superiority theory within them, stating that all laughter contains some form of judgment and aggression. Within the context of mental health, this can be applied to empower people seeking treatment, because when you tell a joke that makes someone feel superior, they'll leave that interaction feeling more confident, leaving that part of them that may be weighing them down. And I will note that I can't find much literature specifically dealing with these theories as they relate to mental health, so this is my speculation, but I believe what I outlined is a pretty reasonable connection to be made. Next, we have incongruity theory. And this is by far the most prevalent theory of comedy. It posits that laughter arises from incongruous or discrepant situations. It was developed by Francis Hutchinson, expanded on by others like Immanuel Kant. If true, as it most likely seems to be, it would provide a basis for our understanding of comedy as CBT. If laughter is based on challenging one's own perception of the world, that can lead to mental growth, as well as an increase in creativity and adaptability. Next, and one of the most interesting theories to this series, is relief theory, which states that we laugh in order to relieve emotional tension, not that a mental health benefit is a byproduct of comedy, but that that's the point. Supporters of this theory argue that when there's a tense moment, we laugh as a psychological release from that. And this, going back to the history of comedy, is parallel to Aristotle's ideas of catharsis, where tragic dramas evoke emotional cleansing or purification. This relief theory provides justification for comedic catharsis, and it serves to explain why watching funny movies or comedic dramas can just make us happy. Finally, a more recent theory, known as benign violation theory, states that people laugh when they feel personally violated, yet safe at the same time. From physical violation, like watching the Three Stooges hit each other on the head, knowing that they're all okay, to mental, social, and even linguistic violations, these latter ones can serve to challenge our own views of the world, leading to a development of mental resilience and adaptability, similarly to incongruity theory. Together, all of these four theories provide a good basis for understanding why we laugh, along with how laughter can actually lead to mental resilience. And it's my hope that in humor therapy workshops, or for people following programs like the 7 Humor Habits, or for any of you who just want to laugh more, have a better time, we can understand why comedy is so powerful, then hopefully there can be more research done into how humor can be best applied to lead to better mental health outcomes. I mean, if we can figure out one universal theory of comedy, or at least a link between all of these theories, we can apply comedy most advantageously to our lives. So for now, farewell. I hope you learned a lot about the science of humor, how it can be applied in a clinical setting. I'll see you in the next one. Bye-bye.
I left my favorite shirt